My name is Rafat Abonour. I'm a hematologist at IU Health, and my role is to direct the multiple myeloma, Waldenström macroglobulinemia, and primary amyloidosis program. IU Health has a very long tradition of providing novel therapy to patients with advanced cancer, solid tumors, and hematologic malignancy. IU Health has expertise in treating relapse germ cell tumors. We've been able to cure a large number of newly diagnosed germ cell tumors with a regimen that was really sort of conceived here by Dr. Larry Einhorn. But for the relapse patients, for over 20 years, we've been providing high-dose chemotherapy and stem cell transplant. And with that approach, we've been able to cure 65% of those with relapse testicular cancer and germ cell tumors, also ovarian germ cell tumors. IU Health has a team of oncologists, surgeon, and stem cell transplant expert that provide a comprehensive treatment for relapse refractory germ cell tumors. The success of our program is that we know what drugs really work very well to treat germ cell tumors, whether it's testicular or ovarian. And we have invented the regimen for high-dose chemotherapy using two drugs, carboplatin and VP16. And we offer 2 cycles of that for relapse and refractory patients. Even in platinum refractory patients, we can cure up to 25% of these patients when we use high-dose chemotherapy. In the relapse patients, we cure up to 65% of patients using 2 cycles of high-dose carboplatin VP16 supported by autologous stem cell transplant. Providing the high-dose chemotherapy is not the only important things, is what to do after autologous stem cell transplantation. When you're trying to cure relapse germ cell tumors, you really need a very good oncologist, very good transplant team, and very good surgical team, and we have that at IU Health. Multiple myeloma is a disease that remains incurable. However, when you use very good induction treatment followed by autologous stem cell transplantation in the early setting, you don't wait on stem cell transplant until later, you can provide your patients with the best remission-free survival and overall survival. Obviously, the advances are going to be offering novel therapies such as CAR T cells early on for relapse and high-risk patients. Those are the patients who are relapsing in the first 2 years. We will have protocols where we'll offer CAR T cells with the hope is that we can provide them with a complete remission that is lasting with minimal residual disease. How are we going to improve the outcome of patients with multiple myeloma? We need to provide novel sort of maintenance or consolidation therapy that depends on enhancing the immune system of the patient. So, for example, CAR T cells have been very promising in relapse refractory myeloma. Why do we wait until the patient is very hard to treat and have disease all over outside the bone marrow? So for these patients who are, we consider high-risk myeloma patients, we are going to offer them CAR T cell therapy early on in the course of their treatment, which the goal is not just to give them complete remission, but to give them a minimal residual disease negative status, because that's when you start curing patients, when they are MRD negative. So at IU Health, we really brought CAR T cells, right away when it became available, and we were the only team offering it here in Indiana. Our goal is to offer the commercial products for CAR T cells that provide control of relapse lymphoma and acute lymphoblastic leukemia. But we're actually going further here at IU Health. Our goal is to really optimize CAR T cells. The problem with CAR T cells today is the specificity, the safety, the durability. So what we're doing here is we have an active research program, which the goal is to try to improve on these things. Because, if the product is not safe, that's not good. If the product is not lasting, that's not good. So our goal is to really optimize CAR T cells, and we are doing that. So here at IU Health, we have, again, a team of physicians that are not just specialized in modality. They really understand the disease. So when somebody comes to see me, when I treat patients with multiple myeloma, I'm not just thinking about stem cell transplant. I'm thinking about every aspect of myeloma. The same thing with lymphoma. We have expert on lymphoma. We have expert on leukemia. We have expert on transplant. We have expert on germ cell tumors. So what we do is, as a multidisciplinary teams, we know how to do stem cell transplant very well. We know how to treat a disease very well. So really, I mean, that's where we offer great service to our referring physician, because we will look at the whole patients, the disease, and try to find the best treatment for that patient. We also have, clinical trials available with novel agents that may not be available everywhere. So our team is really thinking about how we can get rid of these diseases all the time.